Nightshade vegetables. There has been a lot of buzz about them. In the media, in articles, in magazines. Do they affect inflammation? Should you eat them or avoid them? Well, there has been a lot of different thoughts on this. Let's break it down. I'm Dr. Banasali, rheumatologist and lifestyle medicine physician. Which vegetables are considered nightshade vegetables? There are ones that are in our common daily diet, like eggplant, tomatoes, bell peppers, potatoes, specifically white potatoes. And why are we so scared of them? Nightshades were used as hallucinogenic or mind-altering drugs in many different cultures. And in medieval times, they were also used as anesthetics or even poisons. So there has been a lot of different kinds of uses for nightshades. Well, they have this alkaloid molecule in them called solanine. And the solanine, it's been thought, is what triggers the inflammation, especially in the gut, and can increase gut permeability, which we don't want if everything is coming in that shouldn't be there. There's actually minimal research to no research done on whether the solanine from the compound is really triggering inflammatory disease or pain. But despite that, it has been removed in certain diets like the autoimmune protocol diet and one of the Crohn's disease diets. So people are definitely looking at it as something that could be triggering pain, maybe inflammation, gut problems, and other issues. So we need to know what evidence is out there for it. Well, there has been some, and in 2023, a research study was published talking about the different properties of nightshade vegetables and whether it was something that we should be avoiding. And let's look at the data that they came up with. They note that there has been increasing evidence that changing the diet in people who have inflammatory bowel disease, IBD, or irritable bowel syndrome, which is IBS, and changing their diet to, let's say, a low FODMAP diet or a Mediterranean diet or a specific carbohydrate diet can help some people. And even in the Crohn's diet, they remove the nightshade vegetables, but then add them back in. So there has been different diets that suit different people. So what is the fear that's specific to these nightshade vegetables? Glycoalkaloid. And we're worried that high amounts of that could really cause disturbance in the body. But again, in very high amounts of it. So the amount that we're getting in vegetables is probably not going to affect us that much. Now, these glycoalkaloids, also called GAs, are there in plants to defend themselves from pests, from intruders. It's actually a defense mechanism. But where they can be considered toxic is in the green sprouted potatoes, in the stems, in the green skin sprouts, and increased exposure to bright light, or if they're immature, or the way they are stored can also affect them. So these could be toxic to our body. But what do we want to talk about currently? Well, there has been one major food that has really expanded in the last 50 years. Think about the foods that I suggested, and if we think about even as a fast food, the mighty potato. And within that, what has really expanded is the French fry. We see it everywhere. We see it in dinners, we see it in restaurants, we see it in fast food places. The mighty potato that has been transformed to the high-fat, ultra-processed French fry. Potatoes are an important food. They are a crop that is grown in 80% of countries around the world. So we need to know more about them and whether they harm us or help us. Well, there was a 2017-2018 survey that measured our vegetable intake, and they found that French fries and other potato foods made up 3 of the top 5 vegetables that we intake. That's a lot of potatoes. Not only that, another study showed that patients who had IBD had a higher French fry intake. Another study, and this was a mouse study, showed that glycoalkaloids like solanine were given to these mice and they were more predisposed to getting IBD. So that was a mouse study though, but it makes us think, well, the problem with that is what's in a French fry? It's a high-fat food. So fat and ultra-processed foods have also been shown to interrupt the gut barrier, the gut permeability. So you can't really say French fries are going to cause Crohn's disease or French fries will aggravate Crohn's disease. They could in some people, but you have to look at all the other components of it. But certainly makes you have food for thought. What is the data for arthritis? Well, people with rheumatoid arthritis, osteoarthritis have complained that different foods such as the nightshades like peppers or potatoes have aggravated some of their arthritis symptoms or pain symptoms. But there has been no large randomized clinical trials to see if it really helps, or a removal diet that would have been helpful to give somebody with these conditions to see if it made a difference. Although it looks like in 2023, there is a team that's coming out and trying to do a study like that. It'll be very interesting to see the results. What if you were just simply allergic to vegetables in this group, the nightshades? That's entirely possible. It's not a very large amount of percentage of allergies or food allergies, but it's certainly possible to be allergic. So if you're allergic, you should definitely stop them. Our question is, if you're not allergic, could it be harming your body in other ways that we're not seeing because it's inside, it's more inflammation. Now, some people can just see it and they just feel worse. There are definitely people who have triggers, who know their triggers, that they eat certain foods and that sets them off. Certainly, I've heard people who say that they may not be able to have raw tomatoes in a salad, but they can have it cooked on pizza or a sauce. And I've also heard it said vice versa. So it does depend on the person and what they can handle. Potatoes also, barring French fries, have a lot of fiber as well as high amounts of vitamin C and potassium, which could be helpful. And also bell peppers also have a high amount of vitamins A and C and are good for immune health and otherwise skin health. But eggplants contain nasunin, and that also has good important measures for cell membranes. So these are important vegetables that could be helpful in your diet. So if you're not actually allergic to them or sensitive to them, then you could continue having them. So it would be important in this case to possibly have a food journal or a food diary to see when you have a trigger of your symptoms, whether they're gut symptoms, whether they're arthritis symptoms, whether they're pain and swelling, or even skin conditions. It would be important to know what are the foods that you were eating perhaps 48 hours prior to now, or 24 hours before, or even on the day of your symptoms starting, because that could give you a better idea if these were problematic for you. Again, this is not well studied in terms of large randomized clinical trials, but it's not clear that we'll ever have that data. And if there are certain foods that trigger you because of the solanine compounds, then it's something that you could stop. But on the other hand, you may not have to stop the entire group of vegetables. For example, there are certainly people that have intolerance or sensitivity to peppers, but they don't to potatoes. So it does depend on you. So take a moment, take a food history of yourself, see what works with you and what doesn't, and then go back and talk to your health professional team to see if there is some other way that you could use complementary medicine to help your pain, swelling, or other forms of inflammation.